The army is out on the streets, here in one of Johannesburg's poor neighbourhoods. It's trying to enforce what seems difficult for many, staying at home. For the Ledwaba family, lockdown means 6 people sharing 12 square metres. That normally only happens at night when they sleep. And they have no running water. They have to collect it themselves from a tap a kilometre away. Social distancing doesn't really work here, but it's badly needed. Millions suffer from tuberculosis and AIDS and are at particular risk.
That's no choice. We have to come outside.
We have no choice. We have to come to this place to get water and to go to the toilet.
The main roads are almost empty. This is one of the strictest lockdowns in the world. Only those in essential services such as hospitals are allowed to go to work. Food shopping is allowed, but the queues are often long, and few here keep their distance.
I can't go to work, and that worries me. I don't know if my employer will still need me after the lockdown is over.
The standstill will likely ruin many businesses in South Africa. But fear of the uncontrolled spread of the virus is even greater, because it could spell the collapse of the country's already stretched health service.
Let's bring in DW correspondent Adrian Cree. She's in Cape Town. Adrian, this is day 3 of a 21-day lockdown. Already we're seeing soldiers in the streets. I mean, just walk us through the challenges that South Africa will be facing to get people to follow these sorts of public health measures.
Well, of course, it's a very challenging time for South Africans. The measures are extremely strict. You're not allowed to walk. You're not allowed to go out for jogging. You can't even walk your dog. So this is, of course, something people first have to get used to. There's people who are still allowed to go out, those ones who work in essential services, supermarket workers, for example, people working in hospitals. And you can see a little bit of movement behind me on the street at the moment. This is because there's 2 time windows during the day where these people are allowed to go to work and back. They often, however, rely on public transport. And I talked to some yesterday, and they told me, well, it is really difficult for them because not many minibuses operate anymore, and those that operate are totally overcrowded, which is, of course, a problem if you're actually trying to make distance between people and try to stop the spread of the virus.
As we saw in that report, I mean, it's most difficult in the poorest areas. I mean, some people don't have running water. Just talk about the risks that people face in certain areas.
In the poorer parts of Cape Town and also in South Africa, this is, of course, the major challenge in the township where millions of South Africans are living under very difficult conditions, often in crowded spaces, in shacks. And the big question is, how long can they really stay there? How long are they going to be patient? Right now, the lockdown is scheduled to last 3 weeks, but the hope of experts here is that after 2 weeks we will see a decrease in the new infections, but this is not guaranteed. We have no idea if this will really work out, and there is some speculation already if the curfew and the lockdown might be even extended. And then people are, of course, fearing how will people there react? How patient can they be in these very trying times? Remember, many of them don't have a fixed salary. They have to go out, earn money to survive. So this is the big question here. How is that going to continue? How is that going to unfold?
All right, DW's Adrian Cree reporting for us in Cape Town. Thank you very much.